And in 11, cuts to early childcare services are sending a ripple effect through early learning centers across our state tonight. Fox 55's Laquan Richardson breaks down what those cuts mean and how they're impacting providers.
Childcare programs in Indiana are facing two major challenges right now. First, a waitlist implemented back in November has prevented new families from accessing childcare vouchers. They're designed to help working families at or below 150% of the federal poverty level afford childcare. And second, recently announced cuts to provider reimbursement rates will significantly impact childcare facilities.
When they reduce the tuition, childcare providers have a really tough choice to make, right? If families, they either have to pass those costs on to families, or they have to, they can't operate a business without being able to charge what it costs them to care for children.
This is what those cuts will look like across age groups. As you can see, infants and toddlers see a 10% decrease, while with preschoolers, that number jumps to 15. In school-age children, 35. These funds being cut typically cover operational costs like staff wages, food, supplies, rent, and utilities. This empty classroom in Children's Village, operated by Lutheran Social Services, is a reflection of these changes. They have a capacity for 110 kids and currently are only at 62. Now, this is after those voucher changes that happened back in November, and that number is only expected to continue to drop.
10% doesn't sound like a lot, but throughout our center, if you figure that out, across our center, that's a six-figure impact to our budget every year. So those would be dollars, again, that we are using to provide this high-quality early learning that we just will not have.
These reimbursement cuts will cause early child care services to look for ways to replace that funding elsewhere, and local dollars may not be enough to keep the doors open for a lot of places. Reporting from Children's Village, I'm Laquan Richardson.